The quantity of stem cells has declined. The activity of the stem cells has declined. And of course, as you know, when people get to that age, they don't heal very well. So any type of interventions becomes very difficult for the practitioner to help the patient, more challenging. And so the idea here is, well, what if we reset stem cells to a more youthful state with GHK? What would we see? And so we saw after as little as 3 weeks that the brain started to go into a state of coherence. And this was really remarkable. Dr. Chevalier commented that it might take 9 months of therapy, good nutrition, exercise, to see this level of shift that we were seeing in 3 weeks. So this would mean that this woman was sleeping better, she had better cognitive function, her memory improved, short term, the speed of processing improved. So this was very dramatic improvement in health.
So tell me a little bit what we're looking at, with the pictures. What does the red mean, the blue, yellow, all of that? What does that mean?
Yeah, so what this would mean is you have different frequencies that are going on bioelectrically in different regions of the brain, and the ability of, let's say, the pineal gland to communicate with the hypothalamus depends on coherence. So in other words, we want to use something like our frontal lobes for processing information, but that's contingent upon the ability of the pineal gland to signal the hypothalamus, and then the hypothalamus to direct production of hormones and neurohormone precursors to allow all of that to happen. And so these red areas are indicative of an incoherence in the cell signaling, so that it means at this age, for this gentleman at 67, there is internal bioelectrical resistance in the tissue that's prohibiting effective communication from one region of the brain to the other. And so what we see is that as we elevate copper peptide, in this gentleman over a period of 6 weeks, there's a dramatic improvement in the coherence of communications in the brain. And this, of course, then leads to overall better health.
So the more blue you're seeing, the cooler the temperature is, the less friction, so to say, less kind of incoherence it is, so that all the different glands in the brain, neurotransmitters, all of that can communicate more appropriately.
Right. So this is a good tool for practitioners. There's a few of them that we use. Multi-channel EEG. We have a device called a Menla-Scan, which I really like. We use a biopulsar in our labs. They're all, different ways of getting information very quickly, as opposed to doing blood or urine. We do a lot of blood and urine tests, and they're, of course, invaluable. But I really like combining that data with the bioelectrical, because now you get a fuller picture of what's really happening.
Yeah, and dementia, Alzheimer's, I mean, all of that that is a pandemic that's taking place right now. So to be able to have a tool to support the coherence in the brain to reduce risks, for those type of things. I mean, obviously we can't say that anything prevents anything, but at least we want to do everything that we can to maximize our ability to function and to help to regenerate.
Yeah, we did a study over 10 years ago with Dr. Tom Budzinski and his wife Helen Budzinski, and Dr. Budzinski was very, very well known in neurofeedback. There were college textbooks that he wrote, and one of the investigational studies that we did was on carnosine. And carnosine, of course, is a dipeptide which is made up of alanine and histidine, and so is metabolized in the brain. And what was so exciting is that we saw after 30 days of increasing carnosine content in the brain, we could completely reverse age-related cognitive decline. So this is incredibly exciting for people that are dealing with any normal age-related cognitive function, but also people that might have more serious conditions supplementing with things like carnosine and glutathione, to a degree, can have some dramatic impacts on people's overall health and their memory, state of relaxation, and immune health.
And the challenging, I mean, so the supplementing is fantastic. You do have to rely then on the absorption and on the integrity of your gut in some fashion. So obviously,
Right.
somebody with a healthy gut's going to absorb more. Somebody that's older, less healthy gut's going to absorb less. So that's why it's great to have an additional delivery system that does not rely then on your ability to absorb things through your intestinal tract.
Yeah, absolutely. This is, like I said, it's a tool that people can use with healthy diet and exercise and supplementation to take their results to a level that they wouldn't have been able to before. In the area of activating stem cells with copper peptide, this was a gentleman that had open heart surgery and had a pretty healthy scar there. A year later, they received the product in July of 2018, and 30 days later, virtually no scar. So this is because GHK does a great job of managing inflammation. And we know the keloid proteins are going to be responsible for scarring. And copper peptide, fortunately, can reduce keloids and help increase protein synthesis and collagen synthesis. So we get reduction in the appearance of scars.
So for, I mean, here, this is really dramatic, but
right.
And obviously you have women out there that dealing with, C-sections, dealing with a lot of different scars or gallbladder surgery, and to be able to kind of heal those scars becomes tremendous. And what's interesting also, I do a lot of neural therapy, because the scars in themselves create a energetic interference that can create complex pain disorders and other health issues. And so by having tools and to heal the scars and open up that communication through the scars so it doesn't interfere with the electrical signaling through the body, that's extremely helpful. And it's in addition to just the beauty aspect, functionally what happens in the body is tremendous as well.
Yeah, absolutely. And we see quite a bit of this. Of course, in the first example, this was a scar that was there for a year. Here, this was a woman that was coming out of surgery. And you don't have to apply the product directly to the injury, by the way. This is systemic. So we give people a couple of different applications point as a matter of convenience, so you can apply it behind the neck, below the belly button. If you want to apply it to the injury, you certainly can, but it's not really necessary. And here is an example of someone that applied the patch right at the site of the injury.
That's incredible. So this just a month. Oh, look at that.
Yeah, and this was, of course, this was a teenager who had a snowboarding accident, and he used the product and had some pretty significant results after only a few days.
That's incredible.
This one, I have to say I was pretty shocked when we got this in. So this was a gentleman that nearly lost his hand in a car accident. And so he got stitched up and applied X39. And, of course, what was remarkable was not so much even the scar, was the fact that he got the use of his hand back. And that was pretty striking. This was, so we have quite a few members over in Denmark. And this was a case where a 9-year-old boy had caught his finger into a door and it got sliced off. Parents rushed him to the hospital, and the doctor said, well, there's not really anything we can do. And the father begged the doctor to reattach the finger, and he said, well, I can, but it's just going to die. And you can see that's exactly what happened. So fortunately, they had a friend who was one of our distributors, and they got the child the X39 product, and after 2 months, it was like it had never happened. So this was pretty life-changing for him.
Yeah, I mean, this is incredible. See, actually, it's kind of like we were talking about Dr. Becker in regards to his research and the electrical stimulation and growing out, you know, body parts. And so it's the same. We're seeing that here, the same thing, you know, where
Yeah.
you're using these patches and you're actually growing something that, you know, growing back something that was dead.
Yeah, what we're doing with, and this is certainly, on the outer edge, this I wouldn't say is typical, for full disclosure. We
Yeah.
get these testimonials all the time, but this is definitely out on the outer edge of what we see.
But it's just to kind of show what the potential of it, and yes, I
Right.
mean, there's so many factors that are at play, but meaning that what this will do is then support that process. And whether you have that, you know, complete miraculous healing, I mean, that may or may not happen,
Right.
but you're still supporting that process, and you want to give it your all to be able to get that effect, obviously.
Yeah, and the human body has a funny way of prioritizing things. So often people want a certain thing to be healed first, but the body has other plans and devotes resources to other places. We do see, by the way, while many people use this technology for healing, there are plenty of people that use it just for general wellness to stay in shape. So this is a woman in Australia who had been using our products. And so she used the X39 when it came out and was very pleased after 6 weeks with the results. And but after a year, the change was pretty dramatic.
Yeah, you can kind of just see that the tightness around the lips. Yeah, you can see kind of that collagen production, and it's just getting fuller. The cheeks are kind of pulling skin up a little bit more. So yeah, it's really, that's a really striking difference.
And this was her after 2 years of using X39. So, you made a comment before that I kind of chuckled at because I thought I might get the opportunity to show you this picture. You made a very insightful comment before that as you're increasing and improving the activity of the mitochondria, as the cells are dividing, they're dividing as younger, healthier cells. And we certainly see a lot of evidence for that. And this is certainly a case study where we did see that happen.
That's tremendous. Yeah, I mean, looking from day one to 2 years later,
right?
I mean, who wouldn't want that change?
Right, exactly. This is what I'd say would be pretty typical that we see over a period of 2 or 3 months. Is that the skin will tighten, it'll become clearer. There's detoxification going on, skin tightening, new collagen production, better complexion. So this would be very typical of the type of testimonials we get.
Yeah. Look at that. Yeah, you can just kind of see that everything is, with gravity, obviously, as we get older, things and collagen starts to collapse, then everything starts to droop, and you can just see how the skin is lifting up. Eyes are clear. It's incredible.
Now, this would be one again that is a little bit on the outer edge. We have a huge market in Japan, and that market started for us in late 2018, early 2019. And so this would be, the middle photo is about, I believe that was 2-3 months after using the product, and now this would have been after about a year on the picture on the far right. So again, to your point, it shows the potential.
Yeah. We see kind of underneath the eyes, and I mean, it's but you know that when it's happening like this on the surface, what's visible, and just imagine what's taking place internally as well. And that's what's so great. It's not just a superficial healing, it's a whole systemic healing. And that's what we want. We want wellness and health.
Right. To me, absolutely. That's the most exciting part of this, is that this is happening as a result of, number one, improving mitochondrial function, improving the health of the cell, upregulating production of antioxidants, managing inflammation, and mobilizing stem cells. So very much that would be consistent with the data that we've collected, is that in order to get these effects, it's because we're improving the overall health of the body. So this is going to make a practitioner's job a lot easier, because now you have a technology like this that you can use in aftercare to help support the overall health of the patients. And this is just another example of what would be pretty normal that we would see.
That's huge. This is normal.
And then, yeah, this is pretty normal as far as the results we get. Now, this next one was actually the very first, we'll call it youth renewal testimonial that we ever received. This was a woman in Denmark who was having a number of very significant health challenges, which we won't make any claims about. And her daughter is a LifeWave distributor. And so when the product came out, she thought, well, maybe maybe this will help my mom with some of her challenges and make her life a little bit easier. And you can imagine how shocked everyone was to see what happened 2 months later. So this was this was really pretty striking. And this happened in 2018. So this showed us very, very early on, once we took the product to market, what was in store. So it was really thrilling. And of course, we were delighted for her.
I mean, that's like turning back the clock at least 10 years in 2 months. I mean,
it's about that. Yeah. Yeah. It's I should mention, by the way, that Norm Shealy, we've been doing clinical studies, and unfortunately he retired recently. So we've been doing studies with Norm maybe since about 2008, 2009 or so. And Norm and I did 3 years worth of telomere studies. And what we were showing is that we could lengthen telomeres by about 8.5% within 6 months. So so that equates rather to 8.5 years of age reversal in about 6 months. Yeah. So, and of course, doing it totally non-drug. And we had people that were at the lower end, which was maybe about a 1% improvement or so